Assalamu alaikum wa rahmatullah. Sabah al khair jami'an. Today, inshallah, it will be very light talk and light positive talk, let's say. And we are going to focus on the positive effect of the pandemic and the whole experience of the pandemic and different aspects in our life, especially in the clinical practice. So the objectives of my talk that will go through briefly about the pandemic in a timely fashion, then we'll go to the positive effect of the pandemic, a possible positive effect of the pandemic, and then we'll share a local study, multi-center study, led by our team in this regard. So as everybody know that almost we completed 1 year of the pandemic. So in December last year, 2019, an outbreak caused by a novel coronavirus, a new strain, was started in Wuhan, China. In early 2020, the WHO designated the virus its first known terminology. So in the first few months, it was designated with the name 2019 novel coronavirus. On February 11th, 2020, it was named by the WHO as the COVID-19 as a disease caused by SARS-2 virus. And it's needed 2 months in March 12th, almost 2 months or 2.5 months, as the WHO declared the COVID-19 as a pandemic. Locally in Saudi Arabia, the first reported case was for a citizen who came from Iran by proxy through Bahrain. And it was in the news in the March 3rd. And after that, a spree of different cases started. Saudi Arabia, luckily, has a good response as a governmental and COVID-19 steering committee did a tremendous effort to control the disease. We know that, as we said, that in March 2nd was the first case. Following that event, Saudi government started to implement its precautionary health actions gradually. And that's included, but not limited to, partial and complete curfew with lockdown in different city and the lockdown of the whole country. And that was started in March 21st. Just remember this date, please, because things will change after this date. And also cancellation of religious, social, educational, and business gathering, public awareness campaigns about basic personal protective measures with a strong emphasis on hand wash, masks, and social distancing. If we'd like to go for or to have an index that can measure the governmental response to the COVID-19, to the pandemic, to see if any effort that or research done in Saudi Arabia is valid or not to reflect the protective measures. There was a tracker called the Oxford COVID-19 Governmental Response Tracker. And it has an index that measures the government response to the pandemic. And it was released by the Oxford University and adopted by the WHO. So what we are saying is true about the response in Saudi Arabia, as the stringency index was almost 95%. And this is in front of different countries, including UK, France, and the United States, where they have a very advanced health system and response actions. And this was scored highest in April 27th. As of this week, as you know, the cases in Saudi Arabia exceeded 350,000, and worldwide it's more than 60 million. Luckily, 346 recovered, 5,000 deaths, and 5,000 active cases. The world still has a very significant number of active cases at 21 million, with unfortunately the deaths number almost approaching 1.5 million. So it is true that it was a harmful experience, and it caused a lot of pain and suffer as it took the life of many people, including our beloved one. ولا ننسى الدكتور الفكي رحمة الله عليه. So there is no pure evil. It's a quote. Are there any positive effect of COVID-19 pandemic? Any lessons learned? Any example that we can give? I think that and this is my personal opinion, that it's exposed our vulnerability and weakness, a huge gap of collaboration, a huge gaps in knowledge. The whole system, it can be at the edge once it's exposed to global threat. وخلق الإنسان ضعيفا. One of the positive effects that everybody agreed upon was the Earth was in a break during the lockdown and the curfew. And this is a science. So I will start with the non-medical positive effect before going with our data that prove the positive effect in medical and medicine. Or in health system. So the improved air quality was observed. This is an actual image that released by NASA. And you can see in the left, this is the average gas that reflect the air quality. The more dense the color, the less air quality. And this is the eastern coast of the United States, including the New England states, New York and New Jersey, etc. And you can compare it to the right side. And definitely there is a significant improvement in air quality. This is this same period in March 2018 and March 15 to 19, the average. And this is March to 2020. So some experts believe that the improvement in the air quality, this is from Stanford University, that the first 2 months in China, the improved air quality alone saved the life of 50,000 to 75,000. And this is represent a sensitive group. So the improvement of air quality, it saved some lives and decreased the burden of different diseases and improved the overall healthcare. Another observation, and this is maybe not relevant to medicine or healthcare, it's the wildlife is back, and many people shared a different wildlife that's never been observed or seen in the urbanized area, was seen inside the major cities. Definitely another aspect is the enhancement of digital transformation. For example, once it comes to the public health enhancement, Saudi Arabia released 19 application and platform that serve public health function and provide health care service. So it was just the obligatory strongest opportunity to go into the digital age without going back. Imagine the impact in other aspects of our life: education, business, digital infrastructure, social connections, etc. So there was a huge impact, positive impact, and then in the digital transformation. Of course, it's also away from medicine. It's enhanced the international collaboration and disaster planning, and something we should feel proud of is that the government or the Kingdom of Saudi Arabia was leading the summit of G20 during 2020. And one of the main tasks of this announced task was the COVID-19 reflections on different aspects like politics, economy, etc. Back to medicine. Definitely one of the strongest positive effect was in the public health awareness. So there's tens and hundreds of publications studying the awareness, the knowledge, the perception, the practice in health workers in the community and the subgroup within the community like students, etc. And all of these reports, without going in details, showing or confirming a positive impact of the pandemic on the public health education and public health awareness. maybe observation, we observed that people start to ask about details of the preventive measures. They know now for how long you need to wash your hand with alcohol gel or with water and soap, what the proper percentage of alcohol gel. They ask, they know even the distance of the safety distance from individual to control the transmission of any viruses. So this is a lifelong knowledge, and probably it will not be reflected in only in COVID-19, but even in the future situation when it comes to transmission of viruses. So I'm lucky to be part of the Saudi Pediatric Pulmonary Association as a board member, and we have a research team. And we raised, as a KSU member, that probably our population, which is pediatric, is not the main target of the COVID-19, but they are the main target of different entities, asthma, bronchiolitis, pneumonia, and probably whatever we are applying as a preventive measures in COVID-19, probably it will work to eliminate these diseases and these entities, so we can look for the outcomes or during the lockdown and during the curfew, and to see the outcomes once it comes to the hospitalization of these of children with these entities, instead of looking to the COVID-19. So at the time where everybody is busy with the COVID-19, we were looking for the asthma, bronchiolitis, and pneumonia. So as you know, that viruses and respiratory illnesses has a very strong correlation. So viral illnesses in children account for a majority of hospitalization to predict to the pediatric ward, sorry. Viruses are a leading trigger of different respiratory diseases, including bronchial asthma, bronchiolitis, and community-acquired pneumonia. Although the focus of strict public health measures during the current COVID-19 pandemic is to minimize the transmission of SARS-CoV-2 virus, the one responsible for COVID-19, it's a unique opportunity to study their effectiveness on other virally triggered illnesses. And sorry for not adding the reference for the first 2 points. So we established a multi-center study with the aim to navigate whether the pediatric hospitalization caused by asthma, bronchiolitis, community-acquired pneumonia during the months of March, April, and May of 2020 are significantly reduced compared to the previous, to the same months of the 2 previous years. So we hypothesized that the public exposure to the preventive measures to limit the transmission of SARS-CoV-2 will be reflected on the transmission of other respiratory viruses as well, consequently on the number of hospitalizations secondary to viral trigger lower respiratory illnesses in children, like asthma, bronchiolitis, and pneumonia during the early COVID-19 era. So the null hypothesis we have is that there will be no difference in 2019, 2018, and 2020, and alternative hypothesis that there will be a significant drop in 2020. So we designed a retrospective cross-sectional study in 4 centers: King Khalid University Hospital in Riyadh, King Saud Medical City, Shmesi, Saudi Security Forces Hospital, and Imam Abdurrahman bin Faisal University Hospital in Dammam. There were 2 other centers they showed their willingness to join, but unfortunately they didn't make it. The diversity of the scope of this hospital is very clear. So we have 2 university hospitals, and we have 1 military hospital and 1 MOH hospital. So the inclusion and exclusion criteria for this study, we included all hospitalized pediatric patients aged less than 14 years of age with one of the following diagnoses: bronchiolitis, asthma, pneumonia, or chest infection. And there's a group that will be given more than 1 diagnosis, asthma and pneumonia, as we know from clinical practice, so we add it. So that data collector will be able to label all these conditions. So all children hospitalized in March, April, and May of 2018, 19, and 2020 were included. We excluded any child with confirmed SARS-CoV-2. So we are not interested in COVID-19 or children without above mentioned diagnosis. So it's straightforward inclusion and exclusion criteria to make it easy for the data collector. So all pediatric patients who were hospitalized during the study periods were screened. The electronic chart of the included patient who met the inclusion criteria were reviewed. Demographics, clinical and laboratory data like age, gender, clinical diagnosis, oxygen supplementation need, intensive care stay, ventilation support need, and viral study results were obtained and saved in an encrypted Excel sheet by the data collector. Further details also exist. For example, the type of ventilation, the type of oxygen delivery, etc., is available as well. We clearly defined what to mean by hospitalization, just to make it easy for the data collector. So any stay for any period of time in pediatric general ward, isolation, pediatric ICU, and the status is admitted in the electronic chart. Clinical diagnosis was based on the treating team discharge. So we are not giving any diagnosis. We are dependent on the treating team discharge diagnosis in the electronic chart or the admission logbook. Oxygen supplement will be considered needed if it was provided by the treating team for any period of time during the hospitalization via any oxygen delivery device. And ventilation will be considered needed if urgently required if the patient urgently required non-invasive or invasive ventilation in ICU setting. The same thing, definition for viral study. So we defined what's done, what's not done, and what's negative. And for record, once we refer to 2018, 2019, or 2020, we mean by that is the month of March, April, and May of that specific year. What comes to your mind? It came to our mind that there is a possible bias that due to the lockdown and curfew, and a bias drop in the number of hospitalization with the above mentioned diagnosis could happen as a result of possible avoidance of attending health facilities by milder cases, thus hospitalization number. So thus hospitalization number will represent a more severe group in 2020, which could result in higher proportion of oxygen need, higher proportion of ventilation need, and ICU stay in 2020 in comparison to the 2 previous years. So if this is true, then we should see a severe cases in 2020. If you are interested, this is sophisticated statistical analysis using chi-square test. This is a categorical variables, and it was written and done by one of the biostatistician in College of Science in KSU, who's, by the way, a member on this study. So the results, we have a total of 1,003 pediatric patients who were hospitalized and included in the study. All patients were discharged at the time of the data collection. Average length of stay was 5.5, 5.2, and 4.7 days in 2018, 19, and 2020 respectively. And the basic demographic data can be seen in this graph. I believe this is, and once it comes to median age, it was 2 years, but I think this is the collective for the whole group. It didn't, the biostatistician didn't do the sub-analysis for individual years. So the average or the median age was 2 years. The gender, male predominantly, was hospitalized during the study. And the length of stay, as we mentioned, it was 5.5, 5.2, and 5.7 in 2018, 19, and 20, respectively. So the detailed of diagnosis and hospitalization, I will go with the red figures first. It's clearly that we have a huge drop, significant drop in 2020 once it comes to hospitalization. In 4 centers, March, April, and May, there was almost half of the previous 2 years. And that's true in all diagnoses. For example, if we take bronchitis, in 2020, it was 165, 142, and then 63. And the same thing for all other diagnoses. Not only that, if we go to the sub-analysis month by month, on the right, the 3 bar charts are, the 3 bars are representing March. So this is 2019 in orange. This is 2018 in orange. In yellow, 2019, and in green is 2020. we see that the number was high even in 2020, and this was not a statistically difference once we looked at the data in March. However, there was a trend toward less number of patients, and probably, as if you remember, I told you the lockdown happened in 21st or 22nd of March. So probably we start to see the effect toward the end of March. But once we see April, the number of hospitalization dropped by 85%. Significant drop and flattening of hospitalization with these conditions. Drop from 120 in 2018, 119 in 2019, down to 18 in 2020. And the same thing, dropped by almost 90 to 95% of hospitalization. It's 90% actually in May, from 84 down to 7 hospitalized children with lower respiratory illnesses. This is represent all asthma, pneumonia, and bronchiolitis, only 7 patients. So is there a drop in the total number of hospitalization? Yes, statistically significant drop in the total number of hospitalization in 2020 in comparison to 2018, 2019, with a p-value less than 0.001, so it's statistically significant. And this is the main outcome of the study. It was driven by the significant drop in April and May. Statistically, in March, there was no statistical difference from previous years. But in April and May, it was significant drop in the number of hospitalization with a very strong p-value. Is it consistent in all diseases? Yes, we didn't show you the data, but according to the statistical analysis, it was consistent in all hospitalization, the diagnosis, bronchiolitis, asthma, and pneumonia. So our patients, were patients who were hospitalized in 2020 more sick than patients who were hospitalized in 2018 and 2019? If yes, then we should expect more severe cases in 2020 in comparison to 2018 and 19. And the research team used the indicator of severe disease as oxygen need, ICU stay, and ventilation need. So do we have more percentage in these indicators? So just remember that this is the year 2020, and this is the total number of hospitalization in 2020. And this is the percentage in red of patients who needed oxygen. It was 52. So almost half of the patients who were hospitalized required oxygen. And it was 57% in 2019, and it was 46.2% in 2018. The same thing for ICU need. A patient who required ICU stay was 11.9 in 2020, 13.3 in 2019, and 16.1 in 2018. Ventilation need, it's almost matching the previous years. So it was 11.9 required ventilation in 2020, 12 required ventilation in 2018, and 10.4 required hospitalization in 2018. Statistically, it wasn't difference, so the p-value was not significant. So no difference in the indicator of disease severity as per our study definition. Viral study is an interesting story. Total hospitalization in 2020 was 201. Out of 201, 2/3 underwent viral study, which is not a true story in the previous years. So there is a trend by a clinician or a clinical practice of using more viral testing. And this can be explained because we would like to know, and during the COVID-19, what the virus does the patient have. So I'm sure that we screen them for COVID-19, and if it's negative, then we'll look for other viruses. So 2/3 of the patient underwent viral testing. Compared to the previous years, it was 46 and 49%, with significant p-values showing a difference, higher percentage of patient who underwent viral testing. So the clinical practice of using viral testing in hospitalized children is higher in 2020. Percentage of positive viral testing, this is another interesting story. It was higher. So 38 of the patient out of 133 who underwent viral test, 38 were positive. 38% were positive. And if we look to the previous years, 187, only 21% was positive. If we go to the 2018, only 26 were positive. Strong p-value, so it's higher comparison to the positive, the positive viral test is higher compared to the previous years. And we don't have explanation for that. So this is our explanation, proposed explanation, that we are using a better diagnostic tool, a trend of using viral multiplex instead of using a kit to diagnose only 4 viruses or 1 virus like RSV. So probably that this is get better in 2020. If we look to RSV, this is a very interesting story. We look at the end. Actually, we look for the RSV at the end of the RSV season. So if you look to the to March, there were 24 positive tests in 2020, 22 tests in 2019, and 34 tests in 2018. We didn't generate any p-value. But if you look to the April and May, there was, the RSV is almost terminated in 4 centers. So we didn't document in hospitalized patient any RSV. So in April and May, literally it was 0, which is not true in 2019 and 2018. There was some patients reported to have or hospitalized with RSV, 5 and 3 in 2019, and 6 and 6 in April and May in 2018. So it's difficult to generate any conclusion, as RSV season usually ends toward April. However, the flattening of the number of confirmed RSV viruses worth further studies. Even the clinical aspect of RSV is the bronchiolitis. This is very interesting as well, because you can see in March, the number is still high, and it was 99 in 2018, 76 in 2019, 58 in 2020. The observation of a dropping in the number is very clear. But once it comes to April, we used to still have patients with bronchiolitis, 43 in 2018, 48 in 2019, and drop by almost 90% in April. So 4 out of compared to 40 plus. So almost a drop by 90%. In May, only 1 patient hospitalized with the bronchiolitis compared to the previous years. So the clinical bronchiolitis continued, despite that RSV is less. The clinical bronchiolitis in the previous years continue through April and May with much lower number compared to March. But in this year, it's almost flattened. So this observation is worth further studies. So to sum our study, less number of hospitalization in 2020 compared to previous years. The drop was driven by the significant drop in April and May of 2020. Curfew and lockdown did not prevent those who were sick enough to require hospitalization from visiting emergency room, based on our finding. A practice toward more viral testing with higher positive studies were observed. No RSV were detected in April and May of 2020, unlike previous years. So we questioned that RSV season terminated very early in 2020 because of the preventive measures that the community applied. I quote this tweet. It was tweeted last night by His Excellency, the Minister of Ministry of Health. He's referring to a study that I don't, maybe you have encountered it, but I didn't see it, that he say that there is a drop in influenza cases by almost 95% in the last 3 months compared to the previous years. And he suggests what things that we can change in terms of our habits. So the take-home message, the burden of the common pediatric lower respiratory illnesses was significantly less during 2020 in comparison to the previous years. And you can imagine, if we expand this to the global scope, the burden of these disease is much less if we apply our findings by 90 to 95% less compared to the previous years, especially during the lockdown months. And that will be variable from place to place. If you gather this with the improvement in the air quality, improvement into domestic violence, in the street violence compared to the domestic violence, and the outcomes of other conditions that can be triggered by other viruses, definitely there was a positive effect of the COVID-19 And this is also indirect insight about the situation of COVID-19 if these measures were not applied. So if we were able to drop the usual common viral illnesses by 90%, that means if we didn't apply these measures, then it probably will have a much higher number of COVID-19, and the amplification and maximization of COVID-19 negative effect will be inevitable. Thank you for listening, and I'm ready for any question or comments.
Assalamu alaikum.